I'm here today to ask you one simple question. Is healthcare a right or a privilege? But before I hear your answers, I want to tell you a story about when I first came across this issue. Growing up, you could say I was a physically normal boy. Sure, high cholesterol, elevated blood pressure, or maybe diabetes were all issues that at least one person in my extended family had had before. However, as a 14-year-old child, this didn't really concern me. I was told that to be healthy, all you needed to do was exercise and have a balanced diet. Despite this being true, the problem that I realized about healthcare is far beyond this. I never thought about diseases or conditions that were out of one's control. Perhaps maybe type 1 diabetes, sickle cell anemia, Down syndrome, the list goes on. I knew they were all serious conditions, but was never too worried about them until about 5 years ago. As you all know, during puberty, a child primarily goes through a few hormonal changes that affect the way they may look, sound, or behave. Everyone experiences these changes differently. Some people go through them faster than others, which happened to be my experience. Sure, I was the tallest in my class in 7th grade, but this came with one main drawback, which was my acne. Obviously, this wasn't a life-threatening condition, but my experience truly made me understand why healthcare is a fundamental right and not simply a privilege. Acne is normal. Everyone gets a blemish on their face once in a while. However, this was not the case when I was in middle school. My acne had gotten to a point where people wouldn't look me in the eyes, but rather at the scars on my face. Every morning, I was disappointed to look at myself because I lacked confidence in who I was as a person. Each day, I would tell myself that maybe in a few years, I would look normal, and people wouldn't keep asking me if I was okay. After 2 months of being in this position, I decided to consult a dermatologist. Stepping into that office, I felt the most confident I had been ever since I could remember. When the doctor told me that within 3 to 4 weeks, after taking this medication, my acne would clear up. The sheer excitement of having no more embarrassment of my own self was pretty high. At the time, I told myself that after using this medicine and finally experiencing the results, I would feel the happiest I've ever been. Quite ironically, this was true. Around after a month after taking the prescription, I was feeling the best I'd ever remembered. The feeling had lasted for about 2 more months until I had run out of the topical ointment. I wasn't too worried. All I needed to do was get a refill, but that would come with a cost, a really expensive one. I guess that maybe $30 or $40 would suffice for a 50-gram gel pump. Unfortunately, this estimate was off around by $700. To make matters even worse, insurance wouldn't pay a penny for the treatment, since it was deemed non-essential and wasn't included in my package. I scoured the internet to try to find a place where I could potentially find this medication for cheaper. However, I found no luck. At this point, everything in my life changed. I went from being scared to look at my face to not caring whatsoever. My acne had worsened at the time, but my confidence and happiness were the same. Hearing teachers, politicians, and normal people talking about universal healthcare finally clicked. I was never in a fatal condition, but I was able to experience the same dread that one would see after an insane hospital bill or prescription costs. I couldn't stop thinking about people with liver damage, cancer, or maybe heart problems. What would they do? I kept asking myself. If a 1-month supply of topical ointment cost the same as a brand new phone, how much would it cost for a terminally ill patient without any financial support? I kept asking myself these hypothetical questions, but I could never find answers. That's when I began to do some research on my own. This was no easy task, however. There weren't any true answers to my vendor until very recently. The problem with most drug companies is that they're able to manipulate the cost of their products simply because people rely on them to survive. From the perspective of business, it doesn't make sense to lower the cost of a product that a consumer is forced to purchase. In economic terms, this is called inelastic demand. A According to the U.S. House Committee on Oversight and Reform, some pharmaceutical companies have used a portion of their revenue to suppress competition and extend monopolies they had for certain drugs. Another congressional report accused Big Pharma of shadow pricing, in which a drug maker increases the price of an existing medicine to match the high set price for a new drug launched by a different company. This graph, we can see how the launch of Novolog in 2001 was essentially shadow priced by another drug company called Humalog over the course of 20 years. You can see how this rapid insulin drug has inflated, which both serve the same purpose, to lower blood pressure. Except with the launch of Novolog, both of the Humalog and Novolog have significantly increased. Lobbying on the issue of drug pricing has also dramatically increased over the past decade. CREW, an organization responsible for citizen ethics, found that 153 organizations reported some variation of the term drug pricing on their federal lobbying budget disclosures during the first 3 quarters of 2017. This number has more than quadrupled over the past 5 years. 22 of the Forbes magazine's largest drug and biotech companies were found to have lobbied on some variation of the term drug pricing. Collectively, these 22 companies have spent more than $80 million on lobbying during this period. In spite of this problem, Mark Cuban has stepped up with the development of a new company called Cost Plus. His initiative has been able to reduce the cost of prescription drugs for millions of people in the United States through one simple policy: transparency. The price of each drug is explicitly stated and explained why and how it is the same price. For example, a kidney disease medication can be found on his website for $11.40, compared to the $824.59 it goes by retail. Despite this company having saved millions of lives each year, this only solves one problem of healthcare that must be reformed. I want each of you to think about how we can solve the remaining issues: ludicrous hospital bills, insurance refusing to cover important treatments, and preventable medical errors. It's time that we realize that transparency is in fact possible, and it's just a matter of selfishness and greed by the multi-billion-dollar pharmaceutical companies. It's time that we realize that healthcare is something that each one of us has the right to possess. It isn't something we always have control over, and it shouldn't come to a point where our lives are simply at risk because we don't have the means to afford it. It's been a real pleasure speaking in front of you guys. Thanks for having me.